restricting sexual health association, more than half of all people in the world will have or had an STD in their lifetime. So sexually transmitted diseases, also known as STDs, their illness is transmitted from one person to another via bodily fluids, such as vaginal fluids, ejaculation, even saliva. So today I'm just going to inform you guys about some of the many STDs, how to prevent them, signs and symptoms, and where to get tested. So some of them are chlamydia, genital warts, gonorrhea, hepatitis A, B, and C, HIV, AIDS, and syphilis. So the most frequent STD in the United States, according to the Center of Disease Control, is chlamydia, which has about 2.86 million cases per year. It's transmitted through the penis, through the vagina, mouth, and even prenatally. So while the baby comes through the birth canal, it can come out with blindness and pneumonia. So it's pretty serious. Signs and symptoms, it's an abnormal discharge and pain while urinating. So it's known as a silent infection because the signs and symptoms aren't as severe. Treatment for it is antibiotics, azithromycin and doxycycline. If it goes a while without being treated, there's no cure for it. It's just permanent. The next one I'm going to talk about is gonorrhea, which is the second most common in the U.S., which has 820,000 new cases per year, according to the CDC. It's also, just like chlamydia, transmitted through the penis, vagina, mouth, anus, and even prenatally as well, just like chlamydia. Signs and symptoms are just a bit more worse than chlamydia, which is increased discharge, pain with urination. If you have rectal gonorrhea, it's itchy, sore, bleeding, and pain with bowel movement. It can spread into your blood system if it's not treated or if it goes unnoticed, which could be fatal and can cause a disease called DGI. It's treated with antibiotics, which is azithromycin, doxycycline, and Rocephin. The next one is genital herpes. There's two types. There's herpes simplex 1 and herpes simplex 2. The first one, everybody has a bacteria in their body which causes cold sores and fever blisters, which isn't a sexually transmitted disease because everybody gets them, so it doesn't have to be sexual to get it. But the other type of herpes is genital. It causes pain with intercourse, pain with urination, and ulcers. Transmitted through from person to person that have lesions, genital or oral secretions, or mucosal surfaces, with or without sores. If the person has them or doesn't have them, you can still get it from them if they have it. Treatment is also antibiotics, and if you have the herpes in your mouth, it's Zovia. And the last one I'm going to talk about is HIV and AIDS, which is the most serious STD. It stands for human immunodeficiency virus. It can destroy your immune system, and it also changes your cell's DNA. It's transmitted mostly through bodily fluids and any sexual contact, also through blood. So any transfusion, any needle sticks, needle sharing, drug use. So it's a big one. Signs and symptoms, you may not notice it for years. But the main ones are rapid weight loss, stiff muscles, swollen glands, diarrhea, fever, and rashes. There's no cure for HIV or AIDS, but medications are supposed to prolong your life. An example of somebody who did have HIV or AIDS was the rapper Eazy-E. He was admitted to the hospital with a recurring cough and a rash. And then 2 weeks later, he died of HIV. So it can be quick, it can take years, it just depends. To prevent it, the main thing is abstinence, so just refrain from any sexual contact. Condoms, vaccinations for hepatitis A, B, and C. Having mutual monogamy, which is you're just doing it with one person, they're just doing intercourse with you. And to get tested. There's many places to get tested for low to no cost. Planned Parenthood, located all around the United States, and also any Department of Health Services, so the city's DPS site. They'll just take a blood sample, urine sample, fecal sample, or a mouth swab, and you can get the results within hours for that. And it's also good to get your partner tested too, because if you're getting tested and treated for it, and they're not, there's just no point in getting tested for it. So to end this, you guys have an idea of the STDs, how they spread, signs and symptoms, treatment options, prevention, and where to get tested. So basically just refrain from being a statistic and stay safe. And that's it. Thank you.